Parents of children who might be on the spectrum often have a lot of questions. Is my child meeting their developmental milestones? Is this behavior typical? When should I get a diagnosis? If I do get a diagnosis, what's next? All children develop differently, and it's important to remember that autism is a spectrum and can present in many different ways. Still, there are some common signs and symptoms to look out for. One of the first things that we look for is delays in language development. By 2 years of age, most children have about 50 words in their vocabulary, can string words together, and can make requests for preferred things like food or toys. Children on the spectrum often don't have these skills. Another thing we may look for is atypical repetitive behaviors. This could include a motor mannerism of moving their arms in an up and down motion that's not part of a game or routine. It could be a repetitive behavior such as opening and closing a door that seems not purposeful. It could also include playing with toys in atypical ways such as arranging items, sorting toys by color, things like that. A diagnosis can be made before age 2 in some cases. By age 2, most children can be accurately assessed. While awareness of autism is increasing, you may need to advocate for your child and seek an evaluation from a trained psychologist. You do not need a referral from your pediatrician to do this. If you're worried about your child's development, it's important to seek support as early as possible. Some providers have really long wait lists, so it's important to reach out early.
Early diagnosis allows for early treatment. There's strong clinical evidence that starting therapy early can increase its effectiveness. In some cases, it may make sense to evaluate therapy options during the diagnostic process. By evaluating both, you can ensure your child gets the support they need during critical developmental years. If you have concerns about your child's development, consider evidence-based options like the Early Start Denver model. The Early Start Denver model is a play-based therapy designed for children 5 years old and younger. Your child's doctor or psychologist can give you more information about what therapy options might be right for your family.
For more tips and support for children with autism, visit soarautismcenter.com.